Now in hemorrhage, there are certain terms which are used, and number one is petechiae. Petechiae are small, minute 1 to 2 millimeter hemorrhages into the skin, mucous membranes or serosal surface. This is due to increased intravascular pressure, decreased platelet count, defective platelet function, and maybe due to clotting factor deficit. Then purpura are larger, that is, they are 3 to 5 millimeter hemorrhages. And all the above causes, as we see in hemorrhages, they are the causes of purpura, along with trauma, vasculitis, and increased vascular fragility. Now you can appreciate that these are the small hemorrhages which are shown here, whereas these hemorrhages, they are of purpura. And you can ask me that why they are more than 3 to 5 millimeter, because they all these hemorrhages ultimately they become united and they're so close to each other that they appear as big spots. Ecchymosis are larger subcutaneous hematomas. They are 1 to 2 centimeter in size, or they're also called bruises. Mainly they are traumatic. So blood degraded and phagocytosed by macrophages result in the change of the color. We'll discuss. Now, ecchymosis and bruise, these terms are used for each other. Ecchymosis is a skin discoloration caused by bleeding underneath the skin, that is subcutaneous blood, whereas bruise is a pinkish mark on the skin due to leakage of blood from capillaries under the surface into the tissues that have been damaged by a blow. So capillaries which are being damaged by the blow, we usually call it as a bruise. Now during the process of healing, a bruise will usually go through following colors. It often starts red, fresh, oxygen rich blood that has newly pooled underneath the skin. After around 2 to 3 days, the blood begins to lose oxygen, and in certain literature it is mentioned 1 to 2 days, and change of color occurs. A bruise that is a few days old often appear blue, purple, or even black. Now in about 5 to 10 days time, it turns yellow or green color. These colors come from compounds called biliverdin and bilirubin that the body produces when it breaks down hemoglobin. After 10 to 14 days, it turns to shade of yellow brown or light brown in color. Finally, once bruise has turned a light brown, it begins to fade. Most bruises will disappear without treatment within 2 weeks' time. Now, this photograph shows ecchymosis, typical of coagulation disorders. Now, there are other terminologies which are used. Hematoma, which is defined as blood enclosed within tissue. As I told you that with the passage of time in hematoma, there is change in color from red blue to blue green and then golden brown. Hematochezia, which is bright red blood, passes through the rectum with the passage of stools. Why this blood is bright red? Because it has not been acted upon by enzymes and acids, and it is associated with lower gastrointestinal bleeding. Melena, dark black blood per rectum. So passage of dark black blood per rectum is called melena, and it is associated with upper gastrointestinal bleeding. The black color is caused by hemoglobin in the blood being altered by digestive chemicals and intestinal bacteria. Now, hematuria. Hematuria is passage of blood in the urine. It can be gross or it can be microscopic. Gross hematuria, the color of the urine becomes red, where microscopic hematuria, the color of the urine remains the same, and you can demonstrate RBCs in the urine under microscope. Hemoptysis, coughing up of blood. Hematemesis, vomiting of blood. Now, this is a photograph which shows hematoma. You can appreciate that. This is hemoptysis, coughing up of the blood. Hematemesis, vomiting of the blood. Hemothorax, this photograph shows blood in the pleural cavity. Now, rapid accumulation of more than 1500 ml of blood in the chest cavity, which is mainly caused by penetrating wound or disruption of the systemic or hilar vessels, is dangerous. Now, blood present in the pericardium, pericardial space, which is called HEMOPERICARDIUM. Blood present in the joints, you can demonstrate it here, is called hemarthrosis. Now, morphology of hemorrhage. Now, acute hemorrhage is red or purple collection of blood in the tissues, whereas chronic or old hemorrhage is brown or maroon pasty material. Now, when there is hemorrhage, there are certain clinical features which are seen due to hemorrhage: restlessness, anxiety, pallor, tachycardia with weak, thready pulse. The person becomes thirsty, there is rapid breathing, there is sweating, cold skin due to vasoconstriction, peripheral cyanosis, oliguria, hypotension. The effects of hemorrhage also depends on certain factors. Most important is rate of blood loss, volume of blood loss, site of blood loss, and there is already existing disease, that is comorbid diseases like this, like emphysema, anemia, and heart diseases. So I want to say that if the blood loss or if the hemorrhage is taking place from the finger, the effect will be different. But if the hemorrhage is taking place in the brain, the effect will be different. Acute renal failure, liver failure, there are effect of hypoxia, metabolic acidosis, GIT mucosal ischemia, effect on the brain, interstitial edema, hypovolemic shock. Now, in this photograph, which I am going to show you now, you can appreciate intracerebral hemorrhage. Now, clinical effects of hemorrhage, as I told you, that less than 20% loss of blood in a healthy patient hardly matters. So, donation of blood is easily tolerated. But suppose the patient is suffering from heart disease or lung disease, mild blood loss could produce critical results, and more than 20% blood loss may lead to hemorrhagic shock. Bleeding into the brain stem is fatal, while the same blood loss from a finger hardly matters, as I discussed with you. Chronic recurrent bleeding may lead to iron deficiency anemia. Effects of hemorrhage on cardiovascular system, or we can say that cardiovascular failure: reduced volume of blood leads to reduced cardiac output. If the hemorrhage is mild, then the blood pressure fall is slight, which returns to normal. Whereas in severe hemorrhage, significant fall in blood pressure takes place. Effect on skin: there is vasoconstriction, there is paler skin, increase in deoxygenated blood leads to peripheral cyanosis. Effects of kidney: constriction of arterioles reduces GFR, which leads to decrease in urinary output, resulting that renin-angiotensin mechanism come into play. Due to hemorrhage, there is a blood loss, which causes hypoxia, leading to increased secretion of renin from the kidney and formation of angiotensin II. There is release of aldosterone from the adrenal cortex, which causes sodium retention. Then secretion of antidiuretic hormone, and there is increased secretion of antidiuretic hormone due to hemorrhage, leading to sodium and water retention. Effect on the respiratory system: due to loss of blood causes stagnant hypoxia, which is due to decrease in venous return and cardiac output. Effect on the nervous system: release of catecholamine takes place, stimulates the reticular system, causing restlessness, anxiety, and increased motor activity. There is vasoconstriction of other organs, but vasodilatation in brain. Due to hemorrhage, there is decrease of cardiac output, resulting in decreased blood supply to the brain, which leads to unconsciousness. When there is severe hemorrhage, there is severe ischemia, leading to severe hypoxia in the brain. Irreversible damage to the brain takes place if the condition persists for more than 5 to 8 minutes. Now we are going to discuss another topic, which is ischemia. Ischemia is defined as decrease in blood supply to part of a tissue. The cessation of blood supply may be complete, which is called complete ischemia, or partial, which is called partial ischemia. The adverse effects of ischemia may result from three ways. Number one, hypoxia. And hypoxia is due to deprivation of oxygen to tissues. This is the most important and common cause, and it may be of four types. Hypoxic hypoxia due to low oxygen in arterial blood, anemic hypoxia due to low level of hemoglobin in blood, stagnant hypoxia due to inadequate blood supply, histotoxic hypoxia, low oxygen uptake due to cellular toxicity. Malnourishment of cells due to inadequate supply of nutrients to the tissues like glucose, amino acid. Well, this is a less important effect. Inadequate clearance of metabolites, which results in accumulation of metabolic waste products in the affected tissue. This is relevant in some conditions such as muscle ache after ischemia resulting from heavy exercise. Etiology: a number of causes may produce ischemia, and these causes are discussed with regard to different levels of blood vessels. Causes in the heart: inadequate cardiac output resulting from heart block, ventricular arrest, and fibrillation from various causes may cause hypoxic injury to the brain. If the arrest continues for 15 seconds, consciousness is lost. If the condition lasts for more than 4 minutes, irreversible ischemic damage to the brain results. If it is prolonged more than 8 minutes, death is inevitable. Then causes in the arteries. The most common cause of ischemia are due to obstruction in the arterial blood supply. Occlusion can be in the lumen due to thrombosis or embolism. Then causes in the arterial walls like vasospasm, hypothermia, arteriosclerosis, polyarteritis nodosa, thromboangiitis obliterans, and then the injured blood vessel wall. Outside pressure on an artery may be due to ligature, tourniquet, tight plasters, or due to torsion. Causes in the vein: blockage of venous drainage may lead to engorgement and obstruction to the arterial blood supply, resulting in ischemia. Again, luminal occlusion of vein like thrombosis of mesenteric veins or cavernous sinus thrombosis. Causes in the vessel wall of vein like varicose veins of the leg. Outside pressure on vein like strangulated hernia, intussusception, or volvulus. Causes in the microcirculation: ischemia may result from occlusion of arterioles, capillaries, and venules. The causes are luminal occlusion in microvasculature like by red cells as seen in sickle cell anemia, and the red cells which have malarial parasite in it. Acquired hemolytic anemia, sludging of the blood by white cells as is seen in chronic myeloid leukemia, by fibrin as in defibrillation syndrome, by precipitated cryoglobulins, by fat embolism, and in decompression sickness. Causes in the microvascular wall like vasculitis seen in polyarteritis nodosa, Arthur's reaction, septicemia, then in frostbite. Injury is seen in the wall of the small blood vessels. outside pressure on microvasculature as seen in bed sores. Factors determine the severity of ischemic injury, the extent of damage produced by ischemia due to occlusion of arterial or venous vessels depend upon a number of factors, and those factors are anatomical pattern. The extent of injury by ischemia depends upon the anatomical pattern of arterial blood supply of the organ or the tissue affected, and there are four different patterns of arterial blood supply. Single arterial supply without any anastomosis. Some organs receive blood supply from arteries which do not have significant anastomosis, and they act as functional end arteries. Occlusion of such vessels results in ischemic necrosis. Examples are central artery of the retina, interlobular arteries of the kidneys. Then single arterial supply with rich anastomosis. Arterial supply to some organs has rich interarterial anastomosis, so that blockage of one vessel can re-establish blood supply bypassing the blocked arterial branch, and hence the infarction is less common in such circumstances. Examples are superior mesenteric artery supplying blood to the small intestine, inferior mesenteric artery supplying blood to the distal colon, arterial supply to the stomach by three separate vessels, then interarterial anastomosis in the three main trunks of the coronary arterial system. Parallel arterial supply, blood supply to some organs and tissues is such that the vitality of the tissue is maintained by alternative blood supply in case of occlusion of one. For example, blood supply to the brain in the region of circle of Willis, arterial supply to the forearm by radial and ulnar arteries, double blood supply, the effect of occlusion of one set of vessels is modified if an organ has dual blood supply. Examples are lungs are perfused by bronchial circulation as well as by pulmonary arterial branches. Liver is supplied by both portal circulation and hepatic arterial flow. However, collateral circulation is of little value if the vessels are severely affected by spasm, atheroma, or any other condition. Then there is the effect of ischemia is due to general and cardiovascular status. The general status of the individual as regards the cardiovascular function is important determinant to assess the effect of the ischemia, and some of the factors which render the tissue more vulnerable to the effect of ischemia, like anemias, lowered oxygen supply of blood like hypoxemia, senility, with marked coronary atherosclerosis, cardiac failure, blood loss, shock. Type of tissue affected. Now there are certain tissues which can withstand ischemia more than the other tissues. The mesenchymal tissues are quite resistant to the effect of ischemia as compared to the parenchymal cells of the organs. For example, brain can withstand ischemia for a very short period of time. Heart, kidneys, particularly epithelial cells of the proximal convoluted tubules. Then how sudden the ischemia develops, how rapid the ischemia develops. Sudden vascular obstruction results in more severe effects of ischemia than if it is gradual, since there is less time for collateral circulation to develop. Degree of vascular occlusion. Complete vascular obstruction results in more ischemic injury than partial occlusion. Effects of ischemia. The effects of ischemia are variable and range from no change to sudden death, no effect on the tissues if the collateral channels develop adequately so that the effect of ischemia fails to occur. Functional disturbances. These result when collateral channels are able to supply blood during normal activity, but the supply is not adequate to withstand the effect of exertion. Cellular changes. Partial and gradual ischemia may produce cellular changes such as cloudy swelling, fatty change, ischemic atrophy, and replacement fibrosis. Infarction results when the blood supply is completely stopped so as to cause necrosis of the tissue affected. The cause of sudden death from ischemia is usually myocardial and cerebral infarction. The most important and common outcome of ischemia is infarction. Gentlemen, I have discussed the subject. If you have any question, please do write in the comment box and I'll inshallah answer it.